All right, so we're going to do our chapter one lecture for understanding pharmacology. This is kind of the introductory chapter for the whole textbook and helps outline a lot of the general information that you'll carry through the rest of the course. You'll see that chapters 1 through 5 tend to contain lots of generic information. There will not be videos for chapters 2, 3, 4, or 5, as I feel our lecture material simplifies those chapters down in a way that it's much more understandable than a video going over the actual textbook contents would. So, what are drugs? What is drug therapy? A drug is realistically any substance that can alter the human body. We think of drugs specifically as things that can prevent, correct, and reduce healthcare problems, but drugs can also have harmful consequences. Think things like alcohol. Think things like opiate addiction, right? Drugs can be both positive and negative. Some of the most common things that we use every day are considered drugs. Caffeine is a perfect example of this. Caffeine is generally considered the most commonly used drug in the world. You will often see the term medication used interchangeably here. And on the other hand, some people use the term medication to specifically imply something that's being used in a medical setting. And they use the term drug to talk about something that is being used in a non-medical setting. So for certain things like opiates or marijuana, you might see them being called medication, or you may see them being called drugs, and it will depend on the context of the situation. So, why do we use drug therapy? Well, the specific drug therapy all comes down to the specific health problems. The drugs are all going to have a mechanism of action, and that mechanism of action needs to help correct the pathological change that has occurred in the patient's body. In general, if a disease causes a problem, we want the drug to revert that disease state. Okay, whether it directly counters it or it counters it in a roundabout way. We have a couple different key terms to go through here. So intrinsic drugs, these are chemicals that the body makes, right? We all know about cannabis and its effect on the endocannabinoid system, but our body actually has a very robust endocannabinoid system. It just so happens that the cannabinoids made by associated with cannabis are not necessarily ones that our body creates a lot of. You have extrinsic drugs. These are the drugs that we actually take from outside of the body. Pharmacology is the study of drugs. The intended action is the reason a drug is prescribed. Again, we're trying to revert a pathological process of the body. And then side effects are the minor effects a drug has on the body. We'll talk a little bit more about side effects later and some of the terms associated with those. So drug names. There are chemical names that describes the exact chemical composition of atoms and the various other products that are the main ingredient. You have generic names. These are used by pharmacists and all other people with a generic name. The first letter will be lowercase. This is because it is not considered a proper noun. Whereas a brand name, which means it's a drug made by a specific manufacturer, those first letters are capitalized, they are proper nouns, and they're often followed by things that indicate that they have a trademark or other copyright to them. In general, we also have some different drug classifications. You have over-the-counter drugs. These are generally considered safe for the average person to purchase and dispense and use themselves. That does not mean that they are safe for everybody to take, though. They also, just like your prescription drugs, tend to have a very large pamphlet with them that talks about side effects, who shouldn't take them, things to watch out for, etc. And another thing is that they often interact with prescription drugs. Prescription drugs are drugs we get from a prescriber and are dispensed at a pharmacy. These drugs are classified this way because they tend to have a higher risk of things like side effects. They tend to have more warnings associated with them. Only certain populations should take them. If somebody doesn't have a certain disease, they could actually get sick from taking it. So we have to be careful with those drugs. High alert drugs are a classification of drugs where if a person is not using it correctly, they're more likely to experience severe adverse effects. A lot of drugs can realistically be considered high alert drugs. And then we have herbal products. Herbal products are things that are from plants. Now, believe it or not, a lot of our drugs are actually developed from chemicals made by plants, chemicals made by bacteria, chemicals made by fungi, all of these things, right? In general, though, these actual drugs have much higher concentrations of these things in there. It is possible, though, that certain herbal products, like willow bark, for instance, which is where we get acetyl salicylic acid, which is your acetaminophen, they can enhance or alter the effects of other drugs just based on their digestive processes, right? Those digestive processes can interfere with other medications. It would be like a person can take warfarin, for instance, and while this isn't, warfarin's a prescription drug that is used as a quote-unquote blood thinner. It's to help reduce clot risks and help people avoid things like strokes. Well, you can end up taking a supplement, not necessarily herbal, but a supplement with something like vitamin K2. Well, vitamin K2 actually helps enhance clotting in the body. Vitamin K is a major factor for creating blood clots. So guess what? Vitamin K2 products are contraindicated for individuals that are on blood thinners. And that can even include the so-called baby aspirin, your 81 milligram aspirin that people take daily in order to have a very minor blood clot reduction effect to help reduce risk of stroke and heart attack. You often see that recommended for individuals that have risk factors for those issues. Drug regulation in the United States, we primarily have three sides to it. There's the United States Pharmacopoeia, the Food and Drug Administration, and the DEA. The DEA is it's the law enforcement side of drug administration and aims to counter illegal use of drugs and inappropriate prescribing, especially when we talk about controlled drugs, things like opiates. The Food and Drug Administration, on the other hand, enforces safety standards. Okay, and the USP, these are the guys that develop standards. All right. You also have the USDA. People often think of the USDA as being associated with more of foods, but they do have a role in things like nutritional supplements, which again, as I mentioned, nutritional supplements can be powerful tools that can have effects on the human body that may enhance or decrease the effect of drugs. So, pharmacodynamics, the first big word we're getting into. Pharmacodynamics is how a drug works to change the function. This is the mechanism of action. So with a drug, there will be drugs that are very specific and drugs that are less specific. Depending on what we're going for with the effect of that drug actually determines if that's a good or bad thing. If you're wanting to reduce inflammation with something like a non-steroid anti-inflammatory, an NSAID like ibuprofen, it's a little bit more acceptable to have a less specific target, right? So target tissue is key. If we have a drug that we want to help with asthma, right? We want a drug to stop a bronchospasm, something like albuterol, for instance, a rescue inhaler, things like that, which we'll talk about later. you want to ensure that that drug can actually bind to those tissues. If it doesn't bind to those tissues, it will never be able to exert its effect. You might also see that certain drugs can only be administered certain ways, and that has to do with the way that they're brought into the body. One thing is to mention receptors. As you can see here on the slide, receptors sit on the outside of cells. So when we talk about anatomy and physiology, cells often have binding sites on their outside. Well, receptors are basically a binding site where when something binds to it, it exerts an action on the inside of the cell. This can either be direct or it can be indirect via something like a second messenger system. You might also see other terms thrown around like G protein coupled receptors. A lot of that is well beyond what we need to talk about here, but you may see those terms. So this is showing here cells will have multiple different receptors on them. One thing to talk about here, the idea of an agonist. So when an agonist binds, an agonist essentially enhances the effect of something that's already happening, right? You might see things like dopamine agonist, right? Dopamine agonists are commonly used in conditions related to dopamine deficiency, like Parkinson's and dementia, Alzheimer's related conditions. Dopamine has a powerful role in that. So of course we want to enhance the effect of dopamine. So how do you do that? You used an intrinsic agonist, which in this case, because dopamine is naturally made in the brain in the substantia nigra, the agonist produces a greater effect of dopamine. So we're talking about physiologic effects. This is the main concern of the mechanism of action. This is how the drug affects the body. Side effects, on the other hand, are effects that are not necessarily intended, but are just there because of the mechanism of action, and even potentially is related to a unintended binding of a non-target type tissue, right? So with NSAIDs, for instance, you can get adverse effects related to clotting problems, right? In fact, those are actually those are considered adverse effects in our a black box label. But generally, side effects are deemed less important. These are the minor things that you see on every drug. It's like diarrhea, nausea, etc. Side effects are determined realistically when someone is in the drug trial and they experience that effect. It's on the scientists to either prove that the drug didn't cause the symptom, or they accept that the drug potentially causes the symptom. When you see super common and non-important things like diarrhea, nausea, things like that, that's on every drug, it's not worth the cost it would take to actually prove that the drug doesn't cause those things. So that's essentially why you will always see those things listed on every single medication. You'll also see side effects listed where the drug is supposed to prevent something from happening, yet it apparently can have a side effect of causing the disease that you're taking the drug for. Well, guess what? In some cases, that can be true. In other cases, there might actually be an unintended mechanism of action that can do that. And in other cases, it's literally because the drug doesn't always help everybody. This is one example of an adverse reaction that someone can have. This is called Stevens-Johnson syndrome. So adverse effects. Mentioned it before, the term black box warning. These are considered life-threatening adverse effects. These are the ones that everyone always kind of thinks of as really big. One of the most common ones you can think of is anaphylaxis. For drugs that have a common allergy rate, this is definitely listed on there. This is a severe allergic response, and you'll see that there's a supplemental material for week 2 where we actually talk about the different types of hypersensitivity reactions, which is just the scientific word for an allergy. right? You can also have personal type responses to a drug that may or may not ever been recorded, right? That is one of the things about ingesting any substance. You don't necessarily know how they're going to affect you as a specific person or the next patient that comes in. You just never know. Everybody's physiology is slightly different. Next, pharmacokinetics. This is the effect the body has on the drug, right? So this is where we're really talking about things like metabolism of the drug, how the body absorbs the drug, how we process the drug in the body in order to cause it to have an intended action, and then how the body gets rid of the drug. So this right here is showing you the idea of minimum effective concentration. So in general, if the body does not have enough of a drug, you will not have much of an effect, right? If you have too much of a drug, that is considered a toxin and has much higher rates of adverse events and can be incredibly dangerous. This white area in here is essentially the therapeutic range. The idea is for each individual person, you want your minimum effective concentration to be what is being provided. This level, we have studies that outline, the safe level to administer a drug is between this and this. Therapeutic level is between this and this. The idea for a practitioner is to then find the lowest level of drug the patient needs to take to have a significant change in their symptoms and meet their healthcare goals. So absorption, rather straightforward. This is how we get the body the drug, how it comes into the body, how we get it into the bloodstream, or how you get it through the skin, into the mouth, etc. Bioavailability is also another important key concept. That's the amount of drug that can make it to the blood. So remember, as I mentioned before, some drugs need to be taken very specific ways. This is a very high-tech and interesting part of pharmacology. Okay, lots of people make lots of money just designing ways to administer new drugs. Okay, you can take a drug orally or you can get it injected, right? Oftentimes, because the injection goes directly into the body, you need a lower dose. If you take a drug orally, it goes through your digestive system. It gets broken down, it gets messed up, it gets eaten up by enzymes, by bacteria in the gut, all of this stuff. And then it has to essentially fight the final boss of human metabolism, the liver. The liver is an absolute monster when it comes to metabolizing drugs. And in fact, 80+% of all drugs are metabolized almost exclusively by the liver. And even more interesting, a very large number of that is metabolized by just one family of enzymes, which is the CYP P450. Okay? So if you're taking too many drugs that rely on too much of the same metabolitic enzyme processes like your CYP P450, you can also see increased effects, right? It becomes very important to consider all of these things when you think about digesting tissues. So parenteral route, these are injection sites. You can see them listed here. It's rather common. We can do subcutaneous, intramuscular injections into joints. You often will see that with things like corticosteroids. And you can go directly into target tissues. So distribution is the extent that the drug spreads into the specific compartments of the body. Again, this is related to blood flow to that area, the amount of interstitial space and intracellular space that's available in those areas. A big part of this is the size of the drug and the chemical nature of the drug. Another thing to consider about metabolism that's often overlooked. Everyone always thinks of the liver, but our kidneys are incredibly important. Our kidneys can get beat up, especially when you consider things like pain medications, your over-the-counter pain medications, specifically your NSAIDs like ibuprofen and your Tylenol. Taking those at too high of a level for too long results in renal failure, right? Our lungs are also very important in metabolism of the body. There are drugs that you do inhale, things like, we often think of those drugs being related to the respiratory system, and they often are, but the lung has to metabolize them. And then white blood cells. This is really often overlooked, that white blood cells will attack a drug. Well, guess what? Drugs are basically a foreign substance in the body. So of course, our white blood cell is going to say, hey, you're not me. You should not be here. I'm going to attack you. So elimination is the removal of drug from the body. Most common ways are through our lung, kidney, and intestines. Another couple key items to consider, influences on drug activity. Half-life is the term that is used in pharmacology to describe the amount of time that it takes to metabolize half of the total dosage that somebody has been given. A loading dose, some drugs are known for using loading doses. You might see things like corticosteroid packs that are taken orally. Some antibiotics also have loading doses. You take higher amounts earlier on to help get the body up to that minimum effective concentration that we talked about earlier. And then we can also talk about the idea of peaks and troughs, which comes to this next page. Basically, you might see peaks and troughs when testing for levels of a drug. The drug gets administered. It gets administered. Maybe we actually do a loading dose here to get it into the minimum effective concentration. And then you periodically come and are given a new amount of this drug. You might see this with things like injections that are done once a day, injections that are done once a week, right? Some of these things have very long half-lives and can remain in the body for a long time. And you might even see it drugs that you're taking 3 times a day, right? It would just have a lot quicker cycling. Some other important considerations. Children are smaller than adults. They have lower body masses. Children are not small adults, though. They do have different physiology and slightly different anatomy. Things like growth plates. It's incredibly important for providers to consider the fact that they're treating a child versus an adult. Oftentimes, there are guidelines for prescribing drugs for children based on body weight. That is one of the better ways to accurately dose. Organ health. Because the liver and kidney are so susceptible to damage as metabolic tissues, you need to consider what effect a drug can have on them. With the liver, it's not uncommon for people to have both alcoholic and non-alcoholic fatty liver diseases, cirrhosis, etc. That reduces the liver metabolic activity. With the kidney, again, talking about children have very poor fluid concentrating capabilities. That can be a major problem for certain drugs for children. Cardiopulmonary health. Many adults over 70, I would arguably say many adults now starting over the age of 55, bit of a tangent, but cardiovascular health has been on a major decline in the United States and in most developing and developed countries. And it's not just a Western problem anymore. We see major issues with cardiopulmonary disease in certain locations in Africa. You're also seeing it now in places like India. So the world is experiencing this essentially silent epidemic where lifestyle is a major contributing factor. But regardless, older adults tend to have fewer white blood cells, fewer red blood cells. Their blood flow tends to be worse, and those things can all impact the ability for a drug to reach target sites. special populations. Pregnancy is a big one. Generally, drugs are not tested on pregnant individuals. That is a major ethical thing, and we have since found over the years that there may be links to certain drugs and some developing conditions in fetuses. There are drugs that are known as teratogenic. Those have a major black box warning for people that are pregnant. The greatest example of this is a drug called thalidomide. And the situation with thalidomide is that it was approved in Europe and deemed safe for people that were pregnant. Well, here in the United States, they said, oh, okay, Europe has the same testing requirements as we do, so we're just going to push this through as quick as possible. Now it's approved. Well, rather quickly, started finding that women were having miscarriages. Their children were being born with defects, etc. It was a teratogenic drug. And that is actually one of the driving forces behind the FDA drug approval process as it is now. There's lots of red tape, but what happens when that red tape doesn't exist is drugs do not get tested properly. They get advertised as for certain populations where it's actually dangerous. There are several different risk classifications specifically for pregnant women that the FDA has, ranging from literally, if you take this drug, your fetus will essentially be aborted, to there's no known information. Now, the key thing there is no known information. They don't ever say that any drug is actually bad. This is why a obstetrician is always important to consult for mothers with drugs, especially over the counter and even with nutritional supplementation. Lactation. Drugs taken by breastfeeding women can cross into the milk. All right. In fact, there's kind of like concept of a blood-brain barrier that kind of exists in this situation as well. There's evidence that things like antibiotics can disrupt infant bone development, and some drugs do not get fully metabolized. They end up in the milk, and they actually end up being digested by the infant, and they can have other issues. So one big concern with that is things like lipid-reducing medications, things like your statins. They've been shown to actually lead to, they directly cross in the milk to the infant, reduce the infant's levels of things like cholesterol. And as you know, cholesterol is needed for every cell of the body. And they've actually found that it leads to poor brain development and essentially developmental disorders. So again, drugs can interact with literally everything. What do we ingest in our body that's not on here? Ultimately, there's nothing else. So that is everything for this introductory lecture for Chapter 1.